Hi, and thanks so much for joining us today. I'm Dr. Jeff Stanley, and I'm a physician with the Virta Clinic. And at Virta, we're the first online specialty medical clinic that's been proven to reverse type 2 diabetes safely and sustainably, and most importantly, without medications or surgery. So during the webinar today, we're going to go through kind of a list of topics. We're going to start off with just some of the basics and the background behind type 2 diabetes and how we got to such a nationwide and worldwide epidemic of type 2 diabetes and prediabetes. Then we'll talk a little bit about the problem with the dietary guidelines and really give you some information as to why the food that you've been told to eat for years could actually be contributing to things like diabetes. Then I'm going to give you some interesting information, which is actually frankly news to a lot of people, which is why exercise and calorie restriction doesn't work in the vast majority of patients. And a lot of you have probably already experienced that. Then I'm going to talk a little bit about the potential dangers of pharmaceuticals and why medications to treat diabetes can oftentimes lead to negative outcomes. And then finally, we're going to talk a little bit about a different approach to approaching diabetes, and that is reversing type 2 diabetes. And by giving you some of the background as to why the current approach does not work, you'll be able to understand how Virta takes a different approach and why that is able to so effectively reverse type 2 diabetes. And so, like I mentioned, I'm Dr. Jeff Stanley. I'm an internal medicine trained physician and also trained in obesity medicine. I've been with Virta for almost 2 years now. And prior to joining, I was actually a primary care physician for a number of years. I'd like to give you a little bit more background as to how I came to understand that nutrition is so powerful in the treatment of chronic disease. And so my own experience was like a lot of people, I went off to college, I gained the freshman 15, and then I shot right past that. And also like a lot of people, I thought that I could exercise the weight off. I could, eat nothing but cereal and smoothies, and that I would be able to easily lose the weight. And I found that I was wrong. I struggled losing the weight, and it really wasn't until I found out that for my particular chemistry, limiting carbohydrates was the most effective method. And by limiting my carbohydrates, I was able to lose weight, about 40 pounds, pretty effortlessly. And I've actually been able to keep it off ever since. So I've been eating a low carbohydrate diet myself for more than 15 years, and I find it to be incredibly enjoyable and sustainable. So you'll see also on this slide in the bottom corner there, those are my two boys, Will and Jack. And I show this, first of all, just to brag on my kids a little bit. And then furthermore, though, to show you that this is actually a way of eating that can be very sustainable for families. So, they're enjoying a very Virta-friendly dessert of berries and whipped cream. And those are things that, again, the whole family can enjoy. And so as we go through the presentation, I'd like to keep this somewhat interactive. So it's also important to note we're going to have plenty of time for question and answer at the end of the presentation. But in addition, we're going to do a couple of polls. So you should see a poll pop up on your screen, and feel free to answer. It's all anonymous, but we're just trying to get an idea of kind of what people's baseline understanding is. So first of all, what percentage of Americans have either type 2 diabetes or prediabetes? I'll give you a second to answer that. So the numbers are actually pretty staggering. We see that nearly 4 in 10 US adults have prediabetes, so about 38% of adults. 1 in 7 have type 2 diabetes, so meaning that 52% of adults in America, so the majority of Americans, have type 2 diabetes or prediabetes. And the standard of care currently is really a focus on managing diabetes. So you see a couple of quotes here on this page, and the first one on the left from the American Diabetes Association. So they say that type 2 diabetes usually gets worse over time. Even if you don't need medications at first, you may need them later on. And then we see this statistic from Kaiser Permanente, a large HMO that actually has some of the best diabetes care and the standard of care in the country. And in those patients, they did more than 100,000 patients. They saw that there was a 0.1% diabetes remission rate. So this means that people with diagnosed diabetes on medications, only 0.1% of them were able to get a normal blood glucose and off of medications. This also means that the majority of doctors may go their entire career without seeing someone who's able to reverse their diabetes. And I can say quite honestly, this is something in my current job that I see on a daily basis. So I did want to give you just a quick sneak peek of some of the amazing outcomes that we are able to achieve by not focusing on management. So again, we focus on reversal. So we've done a clinical trial in Lafayette, Indiana that is currently ongoing, but we've published some of the initial 10-week data. And what we saw in those people in this peer-reviewed paper is that 87% of our patients were able to reduce or get off completely their insulin. We saw that 56% of patients were able to get their hemoglobin A1C, so their average blood glucose, below the diabetes level. And then we also saw, as we continued this study out, we saw that people lost about 12% of their body weight at 6 months. So this means that someone who started off at 300 pounds on average would lose more than 30 pounds in 6 months. And again, that's just the average. We see some people that lose quite a bit. And we also have people who maybe have a normal weight but have diabetes, and their focus is more on blood sugar management. So now that you have an idea of some of the scope of the diabetes problem, I want to talk a little bit about how we may have gotten here and talk about the problem with the dietary guidelines. So a lot of you probably recognize this blast from the past, so the food pyramid. And thankfully it was recently retired, but basically had been around since the 1970s. And what happened was, in the 1970s, there was a concern about rising heart disease risk. And so the USDA decided to make some recommendations as to what people should eat. And they decided, really absent very good evidence, to base this diet on a foundation of bread, cereal, rice, and pasta. And again, like a lot of you, I followed that diet very closely. And again, like a lot of you, I struggled with my weight following that. It also led the food companies to kind of follow suit with what was wanted. And what was wanted was low-fat food. And that's, again, what they supplied. So you see here the Yoplait Light. A lot of people probably recognize that. So a cup of Yoplait Light, actually, so it's a low-fat yogurt. However, it tastes terrible without when all the fat's taken out. So what they have to do is add sugar. And a cup of that yogurt would have as much sugar as a can of Coke in some cases. Also, you might recognize the Slim Fast. So again, that's something that is not a sustainable way to eat. Sure, you could lose a few pounds here and there by having these shakes, but it's not enjoyable in the long term. And again, certainly not sustainable. And then we also saw this focus on low fat, fat free, but all of these foods, rather than, by taking out the fat, they had to add sugar in order to make it enjoyable. And so what happened with these dietary guidelines? Well, this chart is pretty clear. So you can see in red here that in 1977, the guidelines are published. And we see again that the evidence shows that people followed the guidelines. And so we had a slight increase in the percentage of people with diabetes, and it can take about 10 years to develop diabetes. So the percentage slowly increased, and then all of a sudden we see this huge astronomical increase in diabetes prevalence that continues to this day. And a lot of us would argue that, again, it's due to eating the foods that we've been told to eat. But to break this down a little bit more simply and to kind of get down to the bare bones, let's think about what are the main nutrients that we can eat. So we have carbohydrates, fat, protein, and alcohol. I always want to give a disclaimer that Dr. Stanley is not saying that everyone should make alcohol a major food group, but it is something that is considered a macronutrient and something we have to take into account. And what we've also been told throughout this whole time is that all calories are equal. So it's all about calories in versus calories out if you want to lose weight and avoid diabetes. But what we see by this graph is that actually these different nutrients have different effects on our blood sugar. So carbohydrates cause the greatest rise in blood sugar. So now it's time for another poll. If we have these macronutrients, which one of these requires the most insulin, do you think? I'll give you a second to answer. So as a lot of you said, the macronutrient that requires the greatest amount of insulin is carbohydrates. So when our blood glucose spikes through eating carbohydrates, our body releases insulin, and that causes our blood glucose to go back down. So that's a good thing, because we can think of insulin like a key. And so when you have blood glucose that's elevated through eating carbohydrates, in order to make your blood glucose go down to a normal level, insulin functions like a key, opens up the cells, and tells the cells to take up glucose. If that didn't happen, people would be walking around with a blood glucose of 500 or 1,000, and that wouldn't be compatible with life. But there's something else that insulin does in terms of that key. So it's also our fat storage hormone. So in addition to telling our cells to store glucose, it is also simultaneously telling our cells to store fat. So let's look at what this might look like over time and think about how that might affect things like weight loss and obesity and so forth. So a normal blood sugar, so in someone without diabetes, would be considered about 100 milligrams per deciliter. And in the average person, you have about 5 liters of blood in your body. And in that entire 5 liters of blood, with a normal blood sugar of 100, there would only be 1 teaspoon of sugar dissolved in that entire 5 liters. So then that's 5 grams. So now let's think about a cup of brown rice. So a cup of brown rice is something that would fit very nicely in the base of that pyramid, right? So considered for a long time to be a healthy whole grain. But that cup of brown rice, when we eat it, it goes in our stomach, it's very quickly broken down into sugar. And so that 45 grams of carbohydrates in that cup of brown rice, that's 9 teaspoons of sugar. And our body has to figure out what to do with that. Because remember, we only have about a teaspoon floating around normally. So when you eat all that glucose or sugar, that's going to have a large spike in your blood sugar, and it's going to have a large spike in your insulin. Well, let's think about this in the setting of carbohydrate intolerance, and think about 2 different examples as to how 2 different people might be able to differently respond to that cup of brown rice. So we have the person in green here with the high carbohydrate tolerance. And again, this is the jerk that a lot of us know, who is able to tolerate as many carbohydrates as they want. They can live on bread, rice, pasta, and pizza and never gain a pound. So what happens to them is they eat that same cup of brown rice, their blood glucose goes up a bit, their body releases insulin, but they're carbohydrate tolerant or sensitive, and basically their blood glucose goes down very quickly. Now let's take the person on the right here with a low carbohydrate tolerance. So they eat that same cup of brown rice. They have a larger increase in their blood glucose. They need more insulin to get the blood glucose normal. And remember what's going on that whole time. So the longer that insulin is elevated, the more elevated insulin is, we're telling our body to go into a fat storage mode. So that same cup of brown rice is telling the low carbohydrate tolerance person to store fat, while our other person here does fine. So let's think about this vicious cycle that we set up here. So if you eat carbs over your personal tolerance, and again, this varies person to person, it's genetically determined. Some people won the genetic lottery, and again, they can eat whatever they want, but most of us can't. And so if you eat carbohydrates over your tolerance, you're going to need more insulin to get a normal blood glucose. So your body's going to follow suit and release more insulin. But what happens with time is that the body actually becomes less sensitive to the insulin. So it's kind of like a constant loud noise or a strong perfume smell. At first, we really notice it, but with time, we become resistant to it and less sensitive, and we may not even notice it's around anymore. And again, so we set up in this vicious cycle where people need more and more insulin and overall become more and more resistant to it. Now, in one of the early slides, I mentioned our standard of care sort of throughout the country right now, which again is this focus on management. And what they're trying to do is reduce blood sugar but do it through a couple of different options. So one of those ways of doing it is by directly increasing insulin. So that can be done by injecting insulin, or it can be done through medications like sulfonylurea, so glipizide, which basically tells your pancreas to make more insulin. Then we can indirectly reduce blood sugar through some other diabetes meds. And finally, the recommendation that's given to reduce blood sugar is to decrease body weight. And that's done through eat less, exercise more. And if that doesn't work, then, resorting to things like bariatric surgery. So now I want to talk to you again about why exercise and calorie restriction doesn't work for most people, and particularly not in the long term. So again, with this first step is we tell patients to lose weight. And I'm sure many of you have experienced this. With the diagnosis of prediabetes or diabetes, you go to see your primary care physician and they talk about your abnormal lab value. And they say, the plan for now is let's try losing weight, 3 months. Let's see if you're able to start an exercise plan, eat less, and then we'll come back and we'll check things and see how they look. And the sad thing about that is that actually we see that the body has a lot of ways that it fights against eat less, exercise more. So when I think a perfect example of eat less, exercise more is the television show, The Biggest Loser. So a lot of you probably remember that show where people who struggle with obesity were put on these extremely restrictive diets, taught to run uphill until they vomit and then sort of weighed in public. And in that show, a lot of people lost a lot of weight quickly. But what was seen, there was a study done afterwards where they looked at the people who were in the show and they followed them in the long term. And there's a number of examples of this, but this is just one example where, so this fellow Sean started off the show at 444 pounds. And by winning the show, he got down to 289 pounds. Now, a few years later, he's back up at 450 pounds. So he's above his initial weight. But the cruel thing we see is that in terms of his metabolic rate, so he burns 458 calories a day less than would be expected for a man his size. And quite frankly, probably 458 fewer calories than when he started the show initially and put his body through all of that stress. So, I'd like to, one quick poll to put out to you to think about is, how many of you have been told to eat less and exercise more as a way to treat your diabetes? And you can go ahead and just raise your hand. There should be an option to do that in the poll. And then now I'd like to have you keep your hand up if that worked well for you in the long term. And again, like we see, most people, it's not a sustainable and long-term approach to diabetes or obesity treatment. And it brings up this idea that eat less and exercise more does not work. I found that out in my own experience, and I also found it with the experience of countless patients that I've worked with. Now, it's also important to note that it's not saying that we don't believe that exercise is helpful. Exercise can be great for heart health. It can be great for mental health, but it's just not an effective way to lose weight or to reverse diabetes in the long term. So now I'd like to talk a little bit about the potential dangers of pharmaceutical medication. So the medications that we typically use to manage diabetes can actually have negative consequences. So after part one of our standard of care, again, remember people were told to lose weight, exercise more, eat less. In most cases, again, it doesn't work. So people try their best. They show up at their doctor having given it a real shot, but their blood glucose keeps going up. So then the next step in what doctors expect to do is to prescribe patients more medications. And again, we can start off with things that just indirectly reduce blood sugar, so something like metformin that you may be familiar with. And then the next step is to directly increase insulin, again, through medications like glipizide or eventually insulin. But this has a lot of unintended consequences. So I'm showing you here a graph from what was called the ACCORD trial, so the Action to Control Cardiovascular Risk in Diabetes. And this trial was meant to prove once and for all that lowering blood glucose with higher doses of insulin would benefit patients. So it was supposed to show that people would be less likely to die, that they would have better blood glucose, that they would have less complications for their diabetes. This study was done in 8,000 patients with type 2 diabetes. And in the aggressive insulin therapy, or intensive arm, as they call it here, those people gained significant weight. And remember, this makes total sense based on what I was telling you, right? So when people have more of the fat storage hormone insulin around, it's natural that they're going to gain weight. And so this is despite their best effort. This intensive arm wasn't a group that was lazier than the other arm or didn't like exercise or anything like that. This was strictly via the point that they took insulin. They had about a 5 kilogram greater weight gain than the other group. So again, that's not good news, but it was expected. The thing that really shook up people was this. And basically they had to stop the study early, because what we saw was that aggressive insulin therapy actually had higher mortality rates than the standard therapy. So people who were getting better blood glucose control through insulin actually were more likely to die during the trial. And so now I'd like to pose another question for you, is knowing what you know now, is do you think your diabetes medications are helping you to get better? So I know a lot of the information that I just presented is, frankly, it's sort of depressing, because again, we're showing that eating less and exercising more doesn't work. That when people lose weight using that approach, they tend to gain it back. And then also showing you that taking medications can oftentimes cause negative effects, even a higher risk of death. But I don't want to leave you on that note. So I want to show you that there is actually a different approach to how we can reverse diabetes by getting people off of their medications and still getting better blood glucose control, better weight loss, all the things that our patients really care about, frankly. So one thing, just a point of definition here. So in terms of diagnosing type 2 diabetes, a couple of ways of doing it. The most common ways are with a hemoglobin A1C of greater than 6.5 or a fasting glucose of greater than 126. And so if this is the criteria for diagnosing diabetes, what does diabetes reversal mean? So what it means is that we get people below a hemoglobin A1C of 6.5. And we do it without medications. So we do it, again, while taking medications away. And what we're really doing there is we're reversing the signs and symptoms of diabetes and avoiding the long-term complications. So in talking about these different approaches from the standard of care model of how to reduce blood sugar, really, if you think about it from a common sense standpoint, there's an easier way to do it. And that is directly reduce blood sugar by significantly reducing our carbohydrate intake and relying on energy from burning body fat, or the fat that we eat. And to go back to this graph, this is a really important point. Fat does not raise your blood sugar. Diabetes is a disease of carbohydrate intolerance and elevated blood sugars. So we really should be focusing our attention on the one macronutrient that doesn't raise our blood sugar. And we have a couple of options. Remember, you can be like the person on the left who eats carbohydrates over their own personal tolerance and gets in that vicious cycle of progression of diabetes, needing more insulin, becoming less sensitive to it. Or you can take, again, the fairly simple step of eating less carbohydrates. And you can see here, we set up this virtuous cycle where we need less insulin to get normal blood glucose. Your body releases less, and then you become more and more sensitive to the insulin that is around. Now, I'm not going to try to bore people too much with the science, but I wanted to give a little bit of background, just biochemically, how our approach differs and why it's able to give people some of the benefits that we see. And so what we see here is that our liver is an incredible organ. And one of the things that it's able to do is it's able to convert the dietary fat that we eat, or the fat in our cells, so the fat that we're storing on our body, and take that fat and convert it into what are called ketones. And ketones are actually an incredible fuel source that our body is able to use in order to feed our brain, our heart, and our muscles. And one of the things that's great, and I think sometimes underappreciated about this, is that we all have plenty of fat in our cells. And whereas if you're reliant on glucose for energy, you're really reliant on a very small amount that's stored, and the rest of it is the glucose that you're eating. Versus with our fat cells, even the thinnest person you see will have tens of thousands of calories of fat stored in their cells. And that can be tapped into at any time to help feed our bodies. And what we're starting to see is, so this approach of reducing carbohydrate intake, and we'll go into some more of the details, but in general, it's limiting our carbohydrates to less than 30 grams a day. That gets our body into what's called nutritional ketosis. And when we're in nutritional ketosis, we get all kinds of benefits. So there have been a number of studies coming out recently showing the benefits, which include lower blood glucose, reductions in body weight, improvements in energy, and also improvement in hunger and satiety. So again, a lot of this sounds great, and it's, we love being able to tell people about the incredible results people have, but we also find it really important to put our money where our mouth is and to prove what we're doing. So this isn't a late night infomercial where you hear these incredible claims or you hear about one person who did great. So we are proving our results, first off, in a clinical trial, again, in central Indiana. So we have more than 200 people with type 2 diabetes. And with our approach, we're able to get some of those incredible results that I showed you before, 56% of people getting a normal blood glucose. And again, we're doing that in the setting of taking away medications. And in my experience as a physician, this is something that patients really want. People don't want a magic pill. They want to be able to take control of their health, to get off of medications, and to be healthy in general. And so we help them do that. So first of all, you can see here that in just 10 weeks, we had 87% of people were able to reduce their insulin, 36% were able to get completely off. And those were maintained or even improved over 6 months. And then here's just a whole other host of medications that people were on for their diabetes. And we were able to, again, very quickly reduce or eliminate those medications and keep people safe and healthy. But while we were taking medications away, we actually saw significant improvements in A1C. So if somebody started with poorly controlled diabetes with a hemoglobin A1C of 9, in just 10 weeks, we got them down to 7.2. And then if we have our group here where they started at about 6.9, those people were actually all able to get underneath the diabetes range on average. And we're not a weight loss clinic, but we know that weight loss is really important to a lot of our patients. So what we see is that actually, 71% of our patients were able to achieve what was considered clinically significant weight loss. So if you look at any study on weight loss, they say that if you lose more than 5% of your weight, that's clinically significant, meaning that it's likely to improve your blood pressure, your risk of heart disease, your risk of other chronic diseases. And then again, we saw that out at 6 months, people had lost actually an average of 12% of their body weight. So our approach is different. We're looking to reverse type 2 diabetes and not just manage it. And our mission on a larger scale is to reverse type 2 diabetes in 100 million people by 2025. And obviously that sounds like a very bold plan, but I want to tell you a little bit about how we are likely to be able to do that. So first of all, these are our founders of our company. And what you can see is Dr. Stephen Phinney and Dr. Jeff Volek. So they have been doing research on nutritional ketosis and low carbohydrate diets for more than 3 decades now, and have published hundreds of papers on this. So they're quite literally the world experts on this intervention and have been doing this for years. And they've developed an easy to follow program to be able to eat healthy things, to be able to eat enjoyable foods and get these results. And then our CEO and founder, Sami Inkinen, so prior to starting Virta, he started the real estate app Trulia. And so where his expertise comes in is taking a service, so in first case, real estate, and now diabetes reversal, and putting it in your pocket. So people, our patients basically have a doctor, a health coach, and an entire reversal program in their pocket, in their smartphone. And again, another reason to believe that we'll be able to achieve those kind of reversal numbers is that we know that this approach works. So again, 56% of patients got their A1C below the diabetes level after just 70 days. And those results just continue to get better with time. Again, let's use that common sense approach. Let's directly reduce blood sugar by significantly reducing carbohydrate intake and turn our bodies into fat burning machines. And let's use food as medicine. So rather than adding more and more pharmaceuticals to our list, let's take them away. Let's use the food that we eat to be able to fuel our bodies and to properly retrain our metabolism to, again, burn fat for energy and lower blood glucose. And one of the other points I wanted to make is you'll be able to get further information as to what a day in life in terms of diet would look like. But this is actually a representative menu of what people might eat with our program. So eggs, bacon for breakfast, coffee, salad, delicious snacks, steak for dinner, a low sugar treat for dessert. And I'll go into more details as well again, but we have a number of patients who are vegetarian or have all kinds of different dietary preferences. And so it's not something where you need to eat meat, but it is something that can be compatible if that's something that you like. So let's talk about a little bit more as to how this works. So the one really important thing to stress is that we put our patient at the center of everything we do. So this is, truly an intervention that's based around you personally. And so we have here our patient Wilma, who's actually one of my patients who gave her permission to be shown here. And we start with biomarker tracking. So we are tracking things like blood pressure, blood glucose, weight, symptoms, and those are all going into our app on a real-time basis and tracked. And then you have a health coach who is a highly trained specialist in either nutritionist, a registered dietitian, PhD researchers that really know this intervention front and back. And they are seeing this data and they're giving you daily feedback. So they're saying, oh, based on your blood glucose, it looks like you're eating the perfect things. Or, oh, your blood glucose went up a bit yesterday. What do you think it was that may have affected it? And you can get real-time feedback with everything that you're doing. And then in addition, we also have physician supervision. So this really sets us apart from a lot of the other programs that you may see. So a physician like myself or one of my endocrinology colleagues would be reviewing data, again, constantly. So looking for things like an increase or a decrease in blood glucose, and then adjusting medications as needed. And so you might, based on a blood glucose that's coming down really nicely in the morning, I could send a message to your health coach to tell you to reduce your insulin by 10 units today, track carefully, and then we'll see, if we can reduce further tomorrow. We also have a number of resources, so recipes, videos, guides that are all available at the tip of your finger through your app or through your home computer. And that allows you to really understand why you're doing things, not just what to do. And then finally, we have a patient community. So our patient community offers the ability for patients to support one another, to exchange recipes, exchange wins, exchange challenges, and to really help each other towards a combined goal of reversing diabetes or prediabetes and getting healthier. One other thing I should mention about our physician approach is that we really work to integrate with your primary care physician. So we keep primary care physicians in the loop in terms of any medication changes, how you're doing on the program, and we're able to answer questions as time goes. So again, let's look at what Wilma actually was able to do by following our program. So before she started Virta, her hemoglobin A1C was 7.1, and that was on insulin. So after just 5 months on Virta, she got down to a non-diabetes hemoglobin A1C of 6.1 and was completely off of her insulin. And during that time, she also lost 41 pounds. Now I continue to work with Wilma today, and she's continued to maintain that normal blood glucose, and now has lost over 60 pounds. So one question we oftentimes get is, well, can people stick with this? And the answer is yes. So we see that our retention is actually remarkably high. So in the clinical trial, we had 91% of patients stick with it after 10 weeks, which is great. But we had 89% stay with it at 6 months, which is really unheard of in a research trial. And we're seeing that same results in our patients that are working with us directly. And so you can have these incredible results. And part of, again, why we're able to have this great retention is because we're doing this without calorie counting, by eating real, delicious foods until satisfied, and with no exercise required. So that makes it easier to stick with it because it's not a program of deprivation or of, prolonged long distance exercise if you don't enjoy it. So this is a reminder, to just a quick word of caution, that although this approach has been shown again and again to be safe and effective in a number of patients, the one thing that we have to look out for is in patients who are on medications that either lower their blood glucose, so things like insulin or glipizide, or medications that lower their blood pressure, they can basically have a dramatic improvement in blood glucose. And in fact, it can go too low if they don't have physician supervision. So that's a huge reason why we have a physician supervising you, is to make sure that you don't have that double whammy of meds that reduce your blood glucose and eating less foods containing carbohydrates. And so I would just recommend that, if you are planning on undertaking this dietary approach, that you work with one of our physicians or speak to your own physician about it. Same also goes for family members. So it's always important to make sure that somebody isn't on medications that could potentially cause an issue. Now, I wanted to just review the different ways that we can approach diabetes. So there's the standard approach on the left, where we have diabetes management. And again, what we see in that is a gradual and slow increase in medications, an increase in weight, increased expenses. So a lot of you have probably seen that, insulin, which has been around for 100 years, just continues to get more and more and more expensive with time. We also see that the eating options that people are generally recommended tend to be limited. So if people are told to, eat kind of nothing but salads with low-fat dressing, and it's just not something that people can stick with in the long term. And again, exercise is considered to be required, which quite frankly is not an option for a lot of people who are incredibly busy or who have chronic injuries or reasons why exercise is really difficult or impossible. And then again, we have that standard approach, or we have the Virta approach, where we lower medications, we lower body weight. People have less expenses because, again, you're not paying those copays every month on your medications. We have an eating plan that doesn't include calorie counting and involves a lot of delicious foods. And then we see that exercise is optional. And when you're ready to exercise, that's great. We have a lot of people who tell their coach, I'm feeling great, I want to start exercising. And that's the time to do it. But we don't do it as part of some sort of a punishment program to try to burn calories and lose weight. And so if you're interested in learning more about how we will be able to personalize this program for you, and how you can just learn more about what the specifics of the program look like, if you could just enter in your browser, just go.virtahealth.com, enter a couple of basic pieces of information, and we'll be able to email you ways to get started. And you can also set up a phone call with one of our intake specialists who will be able to answer any questions you have. And at that point, there's absolutely no obligation, no charge, just a good way to get some basic information for you. Okay, well, thank you all for sticking with me and making it this far. So now what we'll do is we'll give you some time to enter some questions, and I will be able to hopefully answer a number of those for you. So I'll just wait a second as the questions come in. Okay. So the first question I have here is, how does a low carbohydrate diet affect my cholesterol? And that's a very common question that we get. And the good news is that we actually generally see a improvement in people's blood cholesterol, despite the fact that they're eating more fats, again, more healthy fats, maybe more cholesterol in the diet. And the main things that we see with that are we see a significant reduction in triglycerides. We see a increase in the good cholesterol, HDL. And those together actually are very powerful predictors of heart disease risk. We also, in general, the LDL or bad cholesterol usually tends to stay about the same in most of our patients. But we actually watch that very carefully, and we work with you to make any decisions. So if you're, everybody's different in how they respond. If you're one of the very small percentage of people whose cholesterol will go up, what we do in that case is we talk with you about options, about it, making adjustments in the diet or making adjustments in potentially medications. But it's very important to know this isn't a one-size-fits-all approach. It's very personalized. Okay. So the one question we have is, what is included with the Virta clinic and Virta program? And that's a great question. So there are a number of things. So again, first and foremost, we have physician supervision. So this entire program will start off with a history and physical via telemedicine, so similar to Skype, with your physician to learn about your personal medical history and medications that you're on, anything that we need to know. It also, we send what's called a starter kit, which has a cellularly connected scale. So that actually tracks your weight automatically when you step on it. It also includes a blood glucose and blood ketone meter, some couple of vitamins, magnesium. We give some broth, which can actually help with symptoms that people will sometimes report in the early stages, which can be easily treated with a little bit of bouillon. And then in addition, the main way that we deliver this is through continuous access through our app. So you really have a physician and a health coach at the tip of your finger, so you can answer questions throughout, ask questions throughout this time, get quick feedback on what you might need to do to personalize it to you. Okay, so the next question is, how quickly does the program make you feel better? Uh, you know, and that is one of the things that's actually I found to be the most remarkable is that for a number of our patients, they get improvement in their hunger, energy, and blood glucose, really within the first week or 2 weeks. So I've literally seen people who are able to get off, they've been on insulin for 10 years and they're able to get off insulin within 2 weeks. That it varies person to person, but that's one of the things I think that makes it so easy to stick with is people get these immediate results. So rather than feeling worse like you usually do if you go on a diet, people will pretty quickly again feel better. And we help coach people through some of the common pitfalls that they may have done a low carbohydrate diet in the past. But if they're not getting the right kinds of fats, if they're not getting enough sodium, quite frankly, they may have felt bad in the past. But we really help people to feel good quickly, and that reinforces wanting to stay on the program and continuing to stick with things. Okay, the next question is, where are the doctors located? And so we are licensed to practice medicine currently in 49 states plus the District of Columbia, and will be soon up to all states. And so what that means is that no matter where you are located, you can have a telemedicine visit with your physician. So using a very similar platform to what you're using right now to watch, basically we're able to do a face-to-face visit via telemedicine. I have a lot of people that have the visit from their office during their lunch break, or they step out in their car and they use their smartphone to do a face-to-face visit. I've had to tell a few people actually to pull over while they tried to drive during their visit. But in general, it's something it's so much easier than having to go and sit in your doctor's office for 2 hours to wait for a 15-minute appointment. It really kind of meets you where you are. So the next question I have is, I eat paleo, but blood sugar remains high in the morning when I'm fasted. So for background on people, I'm sure most people have heard about a paleo or a Paleolithic diet, and there are some similarities to our approach in a Paleolithic diet. One of the things that we see is that a paleo diet is usually a bit higher in carbohydrates than the ketogenic diet. So you get some benefit from cutting your carbohydrates on a paleo diet, but you don't tend to get all of the benefits that come from ketosis. So again, most people who follow a paleo diet wouldn't be likely to have elevated blood ketones, and they wouldn't get those benefits in terms of satiety, weight loss, better blood sugar, things like that. So one of the things that we see with that elevated blood sugar in the morning is that you may need to get your body into that state of nutritional ketosis to truly improve the fasting glucose. It's also one of the things that tends to be the slowest to improve. So we see that the daytime sugars, if you're not eating carbohydrates, your sugars will look great. But the morning fasting, sometimes that's due to stress, poor sleep, other habits that might be coming in. So that's why we really try to personalize it and troubleshoot with your coach. So then the next question is, do you recommend using supplements to reduce blood glucose? So I would say in general, I would recommend against that, just because a lot of the supplements, while there is some promising data about out there about things, like cinnamon or others, there really hasn't been the randomized controlled trials done that can really prove whether it's safe. And so in general, we would say, the best way to do it is really look at that food as medicine and focus on eating real whole foods, getting your nutrients and your supplements from that. And, we can always personalize things if you have something that works or you're working with your doctor. But I'd say as a general rule, we kind of steer away from the supplements. Okay. And then the next question is, does insurance cover any of the fee? So the cost really depends on a number of factors. So that would be such as your employer, what payment option you choose, and also we have a patient assistance program based on income. So really the best way to do it, and as a doctor, I don't know too much about the financial side. The best way to do it is to go enter your information, speak to somebody from Virta, and they can really give a personalized answer on that. Okay, the next question is drinking water important? So absolutely, yes. And you hear some differing recommendations, I think, as to how much is the target water, and how much should I be drinking every day? Should I mark it off on a large cup or carry a flask around with me? And really what we see is that drinking to thirst is probably the most important thing. So if you're thirsty, again, drink more water. The other thing is looking for, the urine color actually is a really good indicator of how hydrated you are. So looking for sort of clearish urine. But in addition to just getting water, it's also important, again, to get enough of our electrolytes. So things like sodium and potassium, and those also help to maintain hydration. So we work with you on that to really make sure that you stay hydrated. Okay. And then the next question is a great one. So why can I exercise and be in shape and run, but have a hemoglobin A1C of 10? So, I mean, I think actually a perfect example of this is I mentioned our CEO, Sami Inkinen. So while he was founding the company Trulia, he was also a very competitive Ironman triathlete and actually won the Ironman World Championships in Hawaii during that time. And the same year that he won the Ironman World Championships, he became pre-diabetic and also had high blood pressure. And what that actually was part of the reason that he decided to start Virta, was that he couldn't believe it, that no one could exercise as much as he was exercising. He was running 20 hours a week, and he was eating nothing but whole grains, and he was doing everything that he'd been told to do. But still, he was over his carbohydrate tolerance. So it's something where your body just has its own carbohydrate tolerance, and running, again, while it's great, I love to run, and I think it's great clears my head, it makes me feel good. I think it's good for our heart. But again, in terms of, reversing diabetes or losing weight, it's just not all that effective. So focus first on what you're eating, and then the exercise can really add on to that and be an added benefit. Okay. And then another question we have here is, do you have anything that I could provide to my primary care physician to help introduce them to Virta? And yes, absolutely. So if you go to enter your data, and when you join the program, you could go to that go.virtahealth.com, and we can send some information. And again, in addition to working with patients directly and doing webinars like this, I also, one of my main jobs at Virta is physician outreach. So we send pamphlets and information out to physicians. We can speak directly to a physician if they have particular concerns. And then again, we also send regular scheduled updates to primary care docs, so they know how you're doing. And I originally had thought that there would be a little bit more maybe skepticism from doctors, but what I've seen in almost 99% of the cases, that they've been very supportive. And they, primary care doctors generally, they want what's best for their patient, and they want their patient to get healthier. And if we're able to do that, then they've been incredibly supportive. Okay. And then another question we have is, can you measure carbohydrate tolerance through a blood test? Is this backed by study science, or is this more observational? So, I mean, again, probably one of the more powerful ways to look at it is really just our observational say, where, we can see things like when I add back certain foods, I start to gain weight, or blood glucose starts to go up. So one of the ways that we can see sort of a cruder measure of carbohydrate tolerance is, through daily measurements of blood glucose and blood ketones. And if someone has a lower carbohydrate tolerance, we see that their blood glucose will go up, and they will be knocked out of ketosis by a level of carbohydrates that would not do that to somebody else. And that's something that also changes with time in terms of how insulin resistant or carbohydrate tolerant someone is. There are also some more advanced ways. So there have been some interesting studies that actually look at some of the fatty acids that are made by our body. And there are some that can only be made from a carbohydrate. So it's called de novo lipogenesis. And it's basically a fat that's made from a carbohydrate. And what we can look at is when people start making these particular fats, then that's a sign that they are over their carbohydrate tolerance, and they're no longer burning the carbs, they're turning them into fat. So those are some of the more advanced things we can look at as time goes on. But again, some of the very quick feedback we get is when people start regaining weight, or when people's blood glucose goes up, or ketones go down. Okay. So then the next question we have is, please explain ketones again. Didn't quite understand the first time. And thank you very much for asking that. It's great to have some clarification. And it's something that people, really don't hear all that much about normally. Or when they do hear about it, they hear about it in the context of diabetic ketoacidosis. So I think the first thing to note is that, again, so ketones are a fuel source, or a molecule that is made by our liver, and it can be made from fats that are circulating in the bloodstream. And so the most common, the one that we test from our blood strips, is called beta hydroxybutyrate. And again, beta hydroxybutyrate can be used by our cells to make energy. So similarly to where our body can burn glucose for energy, they can burn ketones. And ketones are made in a couple of instances. So either if people are fasting, so by fasting for probably 24 hours or more, your body goes into this fasting state and starts to burn fat for energy and raise blood ketones. And then the other way, the more enjoyable and sustainable way, is through limiting carbohydrates. So the standard approach would be less than 30 grams of carbohydrates, but it really varies personally by people's own tolerance. And when you get in that state of ketosis, again, your body is still burning glucose for energy, but it's also burning ketones. And that, again, allows for a little bit more steady state of energy. And what's, again, been interesting we've seen lately is, just in the last month, you may have seen some things in the news about, there was a study on mice who were put on a ketogenic diet, and they lived about 13% longer than mice that were following a regular diet. And the thought was that the ketone that their body was producing may increase longevity. Now, again, that's not been studied in humans, but it certainly is interesting and promising. And then the final point I would make about ketones are that, again, so this idea of diabetic ketoacidosis, that is a very serious condition that occurs when someone with type 1 diabetes doesn't take insulin or is very sick. And what can happen is basically blood glucose goes way up, so over 300-400. Blood ketones go up maybe above 10, and it's a very serious condition that requires people be in the ICU. But nutritional ketosis is about tenfold less in terms of the amount of ketones floating around. So your body's not acidotic. It's just in a normal, we call it physiologic range. And so it's something that even some physicians and dietitians and nurses get scared when they hear the term ketones. But in fact, it's very normal if it's in the physiologic range. Okay. Another question we have here. So this is, it said, if you have multiple sclerosis and irritable bowel syndrome, what diet works? So that's something where the long-term studies really haven't been done yet. But what I can say is that, anecdotally, so through patients that I have worked with in our Virta clinic, so people who had diabetes, but maybe also had multiple sclerosis who signed up, we've seen people have had some pretty dramatic improvements in their symptoms. It's the most likely cause of that would probably be there's an anti-inflammatory effect of the diet. So we do see that people's inflammation markers go down. And then we also see that, by basically some of these conditions like MS, other autoimmune diseases, may also have to do with energy problems. And so by supplying more energy through ketones, that can help people. And then around IBS, we have seen a number of people whose IBS symptoms improve quite a bit with the diet changes. Now, sometimes it requires more fine tuning because people might get 90% of the way better by cutting out things like gluten or certain dairy products or sugar. But then we may need to dive in a little more and figure out if there are other things that they might be sensitive to. So the best way, again, we can't really make claims without having done the studies on it. But for something like MS and IBS, I've advised people that it's certainly worth giving it a try because there are good common sense and mechanistic ways that could explain why it would work for people. So another question we have is low thyroid related to high blood sugar? And so the thyroid, there are cases where certainly if people have low thyroid levels, they tend to be more predisposed towards obesity. We do see that people with low thyroid can tend to have higher blood glucose levels. They're more fatigued. There's a lot of things that tie in with that. And what we see is that a ketogenic diet appears to sensitize the thyroid a little bit to thyroid hormone. So we've seen some improvements in thyroid symptoms with that. But in general, that's something, and that's part of why we do a lab workup ahead of time to see if people have something like an underlying thyroid issue or if it's properly treated, to really make sure that they're getting the right medical treatment on the medications that they might need to be. So another question we have here is, I have fatty liver, will this help? And that is something where there's actually some pretty good data that a low carbohydrate or ketogenic diet can help with fatty liver. And the couple of mechanisms of that. So again, one of the things we see is people's triglycerides go way down, and triglycerides tend to be the fat that is stored in the liver. And so again, by turning your body into a fat burning machine, we're burning those triglycerides for energy, taking them out of the liver. There was actually a remarkable study where they had one group of people who had fatty liver did 6 days of a low carbohydrate diet versus another group that did 6 months of a low fat diet. And they actually found that they had better improvement in the 6-day low carb group than in the other group. So it's pretty dramatic and quick. And we actually have seen, improvements in people's liver tests from being on the diet intervention. Another question we have here is, will the body heal from the effects of high blood sugar? And the answer to that is yes. Now, it differs in terms of the time frame. So if someone has had diabetes for a long time, there can be some chronic issues. So kidney disease, eye disease, retinopathy, the neuropathy, so tingling of the extremities. And some of those can be irreversible if the damage has been done for too long. But we have seen people who have remarkably improved their neuropathy, so they can start to get feeling back in their toes. The other thing that we see is just the sort of insulin resistance that people have from diabetes can definitely improve with time with this diet. And so we have done testing on that. A number of studies have done testing on that, where with time, people's insulin levels drop dramatically. So it's proof that they are needing less insulin with time. And again, that they're having some of the other effects where we've seen kidney function get a little bit better in cases. So there is reason to believe that this can reverse some of the sort of chronic damage done by the high blood glucose. Okay, another question we have here is low testosterone related to diabetes? That really can vary, I think, on a personal level. I mean, one of the things we say is in somebody who has, clinically diagnosed low testosterone, that can have a number of negative effects. So people can have issues with energy, weight loss, things like diabetes. So appropriately treating a low testosterone can definitely help with those. There's some controversy as to how low testosterone needs to be treated, who should be treating it, and so forth. And so we don't directly prescribe those medications, but again, we could work with your doctor if that's something that you're dealing with. It absolutely would be reasonable to work on. Okay. And then we have, looks like time for just a couple more questions, if there are any. One additional question I have here is, how does metformin work on a biological level, and does it raise insulin? So this is actually an excellent question, in that there have been some papers lately that actually state that we don't quite know exactly how metformin works. It seems to, it doesn't directly increase insulin. And one of the good things is that you can take something like metformin and cut your carbohydrates, and that will not cause a dangerously low blood sugar. So whereas if you're injecting insulin or taking glipizide, it could drive your blood glucose dangerously low. So metformin won't do that. It seems to lower the output of glucose from our liver as sort of the main mechanism. But again, I was shocked to know as time goes on, and as I've read more about it, that the actual mechanism of metformin is not completely understood. Okay. I have time for one more question if anybody wants to pose one, but those were an excellent list of questions. Hopefully I answered them sufficiently for you. Okay, it looks like somebody squeezed one in. Perfect. So is sugar-free foods as important as low carbs? So, one of the things that I think is really important, and one of the things that our patients get really good at quickly, is about reading the labels. So, something can be, what we're seeing a lot now is things like no sugar added or sugar free, but it can still have carbohydrates. So an example of that might be, bread or rice, where it doesn't have sugar added, but it does have carbohydrates. And in someone with diabetes or prediabetes, those are pretty quickly going to raise blood sugar. And so, the key to look at is to not just look at if there's sugar, which again is good to avoid, that's great, but also look at, are there, what is the carbohydrate count of whatever the food is. One thing that's been very nice is that as low carbohydrate and ketogenic diets are becoming more popular, it is becoming easier and easier to find low carbohydrate foods. It's easier to find sugar-free treats and things like that. And so you can definitely, as you adjust to the program, you can make that a part of your lifestyle. And so again, just a final reminder here, if you were interested in what you heard and you'd like to learn more, or maybe you know a friend or a family member who could benefit, definitely visit the website go.virtahealth.com. And from there, you can get more information and again, set up a call to chat with somebody with absolutely no obligation. So thank you again so much for taking the time to listen today. And hopefully I got through to a few folks and got you interested. And this is the first step towards really changing your health and your life. Thank you so much.